Welcome. My name is Wendy Schiller. I am the Allison S. Ressler Professor of Political Science and the Interim Director of the Watson Institute for International and Public Affairs. Thank you for joining today's event, which is part of Watson's exclusive webinar series, which brings together experts to explore some of today's most pressing policy challenges. As many of you might have heard, the Watson Institute will become the Thomas J. Watson School of International and Public Affairs on July 1st, 2025. We're all looking forward to that. We're very excited about all of the terrific policy knowledge, policy expertise, and opportunities for graduate students and undergraduate students that will come with this school. Today, I'm speaking with Professor Margot Jackson, Professor of Sociology and Director of the Population Studies Training Center, whose research focuses on poverty, inequality, and the role of public policies in shaping the lives of children and families. Her work examines how social and economic conditions influence early life experiences, educational opportunities, and long-term economic mobility. In this conversation, we'll discuss the effectiveness of social safety net programs, the evolving demographics of families in poverty. What do we have in terms of a picture of families in poverty in America? Do we really know? Do we sort of get statistics, but we really need somebody to help us sort through who's in need, why they're in need, and what's available to help them. And of course, the policy changes needed to better support children and families. We'll also consider how shifts in federal priorities could impact those most in need and a lot of these existing programs that we have. So I'm going to dive right in with the first question. Professor Jackson, you're the Director of the Population Studies and Training Center at Brown. Could you share a bit about the center's work and the key issues your research in particular focus on?
Yes, absolutely. So as you mentioned, I'm the Director of the Population Studies and Training Center. We colloquially refer to this as the PSTC at Brown. And this is one of the oldest research centers at Brown that was established over 60 years ago, which is interesting to think about in light of what I'll tell you about the center's work. And so broadly, we are a demographic research center on campus that is focused on understanding how different features of populations, so not just the size of the population, but also different indicators of the structure of the population, like its distribution with respect to income or education, how those features have really striking implications for pretty fundamental social, economic, and political features of communities at different scales, local, national, and global. And the center was really formed, as I said, 60 years ago at a time when the kind of dominant concern was about global population expansion, or what was referred to often as a population explosion at the time. This was a time of really rapid population growth around the world, and that led to a series of pretty big concerns about how population growth was shaping social and political discourse around things like economic development, the challenges of providing adequate food or housing or education to a growing population, right? Today, of course, population growth is no longer a concern. We're now concerned about the opposite problem, which is population decline. And we have a new set of concerns or threats to the welfare of human populations. So think about things like declining life expectancy in the United States and other societies, growing quote, depths of despair, as we often refer to them in the US, low fertility rates in many societies, and also the impact of migration on economies and societies. And importantly, from a policy perspective as well, the effects of population aging, or what we call kind of population graying, on government programs and budgets. So this is a whole new kind of set of concerns that we have. There's also growing public understanding about really strikingly uneven and unequal levels of economic opportunity in the United States, as well as in many other societies. So those are some of the kind of driving questions that motivate us as a center. And we are an interdisciplinary kind of research hub on campus. We develop programs to support faculty research, student research. We train students at all different levels through courses and workshops and skills-based courses, and we disseminate evidence to hopefully kind of shape policy and practice.
I'm going to interrupt just for a second, because there are two things that I think are important that some of our viewers may or may not know. So when you say you work with departments at Brown, could you just tell us which departments you work with most closely? That's the sort of academic organizational question. And the second question is, life expectancy. I'm a political scientist, and I would love a quick tutorial on how we calculate life expectancy in the United States. And is it driven more by sort of the number of children we lose, infant mortality rates, or is it driven by sort of the length of time most people live at the end of their life? If you could break that down sort of substantively, I think that'd be really helpful.
Yeah, that's great. So to your first question about kind of where our reach is on campus and who we work most closely with, we are really primarily focused on social science, and also to a smaller extent, but importantly, supporting people in the health sciences and in the School of Public Health. Within the social sciences, traditionally, I think our kind of dominant, participants at the faculty and student level have been in sociology and economics, and importantly, to a smaller extent, but in a really central way, anthropology, where there's a long tradition of kind of anthropological demography work at Brown. I would love to have more engagement with political science, which hasn't traditionally been one of our kind of key partners, but I think given our work, would love to see more growth in that connection as well. So that's a little bit about kind of where we fit on campus. With respect to life expectancy, it's a good question. You could take many courses on that question of how we calculate life expectancy. But really, in order to understand life expectancy, we need really good data, especially on mortality, on deaths. And we need information on deaths at very specific ages. And so if we take about, the case of a place like the United States, we rely very heavily on what we call vital statistics data that are reported by states and kind of aggregated at the federal level so that we can measure in a lot of specificity information about the exact ages of mortality across groups. And we use that information to calculate, to kind of do some projections and simulations to calculate life expectancy for different groups.
So what you're saying is there isn't common agreement among scholars about how to calculate this, or that you're working towards that? Because I think one of the reasons I'm pushing you is that you're in a perfect position, given where we're in transition now from one administration to the next, and thinking about data and information availability. And of course, the 5th year anniversary of COVID, our life expectancy seemed to have gone down because we lost so many people in COVID. And the question is sort of that our trajectory going forward, which you mentioned, or do you think there's sort of a scenario in which the United States life expectancy might actually expand, might get longer?
Yeah, so with respect to the measurement question, there is a very strong consensus about the best way to calculate life expectancy. So that, I think, is kind of settled territory with respect to the academic literature. With respect to what the future may hold, though, I think that is definitely an unsettled question. There has been a pretty troubling pattern, right, of declines in life expectancies, particularly for certain groups in the United States. The group that's gotten the most press and attention has been the kind of declines that we've seen, particularly among white men in the United States in recent years. And there's a lot of interesting research that tries to understand the role of certain social changes like the opioid epidemic, declining economic opportunity for certain groups, and how that may have played a role in changing life expectancy. But just as much as it can decline, of course, it can also improve. And so that's where we need really good data to be able to track, right? Who's dying? What is the probability of surviving to a certain age? And how much, estimated remaining years of life, right, do people have in particular groups?
So, I mean, your repertoire is so vast. So I'm going to try to get us back on track and think a little bit about the kinds of questions you study. So in terms of your individual research, you have a fairly broad portfolio, but could you just share a couple of the sort of the central core focuses of your research?
Yes, absolutely. So my work, especially recently, has really been focused on, as you said in your intro briefly, the role that the U.S. social safety net, and I'm happy to talk more about kind of how we define that, but think about programs like childcare support, public health insurance, tax credits, the set of public programs that are both kind of going directly to families in the form of money, as well as going to support families and children in the form of kind of in-kind services, right? Which is how we typically think about a program like health insurance, for example. So I'm interested in how this broad patchwork of programs works together as well as independently to structure the lives of parents and children. So I've focused on understanding how the safety net affects the way that parents can spend money and use their time with respect to their children's development, as well as how it directly impacts children's outcomes through, for example, affecting levels of infant mortality or levels of birth weight. And I think just to back up, I think it's useful to keep in mind that in the United States, about half of children, right, about 50% of kids in the United States live in families with low incomes, meaning that they have incomes that either are below or near the poverty line, right? And so when we keep that number in mind, this means that for all kids, but especially for this really large group of kids, both families as well as governments are really going to play a critical role, right, in giving them the resources that they need for healthy development. So that's kind of the starting point of my work. And I've been really focused on trying to both kind of measure what we mean when we talk about the size of the safety net and the generosity of the safety net. So how much money, right, do governments report spending on kids, on all of these programs? How has that changed over time, right? What is the average benefit that a typical family with a certain profile in a specific state in a specific year could expect, right, from a program like TANF or from a program like the EITC, right? And how has that changed over time? So part of it has been a kind of measurement focus of really trying to carefully measure the size of the safety net for kids over time. And then a related part of that, the more kind of academically interesting in some ways, has been trying to understand the effects of these different indicators of safety net generosity on the types of behaviors that we see, right, among parents and kids.
So in terms of, I'm going to ask you some specifics about, you just mentioned temporary age and needy families and the earned income tax credit. And I'd love for you to expand on which of the social safety net programs that, you think are sort of most important right now. But before we go there, a startling statistic that 50% of children in America live either at poverty or under poverty. Is it the case that the number of children in a family is correlated with education and income? In other words, is it the case that people with higher levels of education and or income have fewer children? Is there any sort of conclusion we can draw on that in that score?
So there definitely are pretty striking differences across educational groups, less so by income, but educational differences in fertility, or, kind of the more formal term for what we think of as the number of children that people have. So that is definitely a kind of parallel trend. Although, yes, and so one consequence of that, right, is that when we talk about the profile of people who are living in poverty or near poverty in the United States, we are disproportionately talking about families who have low levels of education. That is something that we can come back to for sure when we talk about demographic, patterns, right, of who's living in poverty.
So I think for this population, which are of the programs that the federal government has, which are the sort of two that you think are really the crucial components of the safety net right now?
Yeah, so that's a great question. And that's actually one of the big kind of areas of focus of my current work, which is trying to figure out, in this era of kind of having to prioritize public dollars and weigh programs against each other, right, which types of investments kind of give the biggest return, right, so to speak. And this is actually a pretty difficult thing to figure out because the vast majority of research focuses on the effects of one particular program, right? And there's a really good reason for doing that because, of course, we want to be sure that when we're measuring the effects of a program, we're not mistakenly picking up, right, the effects of a related program. However, some of my recent research, as well as research from other people, suggests, perhaps surprisingly, actually, that when we're trying to predict outcomes like child health, for example, and understand which programs improve children's health the most, right, if we're investing in kids, perhaps surprisingly, the evidence seems to suggest that investments in non-health programs are just as beneficial for child health as investments in health programs like Medicaid and CHIP. So the dollar for dollar effect of investments in programs like housing assistance, housing subsidies, cash assistance are just as large as the effects of programs like Medicaid and CHIP.
And you think school free lunch, like, does that count as some of the things that you measure?
Yeah, school free lunch doesn't typically fall into our definition of cash assistance, but it would fall into kind of a big bundle of resources that we would think of as kind of food support or food assistance more generally. Those programs are not as big as programs like SNAP, for example, which is what we kind of refer to as food stamps, right, in the United States. But with that in mind, there is some work showing that food assistance in particular, as well as refundable tax credits like the earned income tax credit and the child tax credit, play an especially large role in the US in reducing poverty. And even in reducing indicators like the Gini coefficient, which is one of the indicators we use to measure income inequality in the United States. So those two programs in particular, which we wouldn't traditionally think of as health investments, right? They're not public health insurance. They're not spending on health per se, but they've proven to be pretty effective poverty reduction and anti-poverty programs.
Well, that's a great segue into the next question, which is really about effectiveness. So you can argue since the 1960s, a lot of programs, as you said, have been created to reduce child poverty in particular. But sometimes it seems as though we're not making as much progress, I think, as a society as people would like. And what are the kinds of changes that you might suggest to make some of these programs better? I know somebody who's sort of a famous politician once said, if a child doesn't get a good night's sleep in a safe housing environment and has trouble even navigating their way to school, is tired and then hungry, by the time they get to school to start their day, they're behind. So in what sense do you think we could make changes at the local, state, or federal level to make these programs deliver more than at least what people think that they deliver?
Yeah, I think that's a great question. And I think one thing that I would emphasize as my punchline answer to that question actually is that contrary to perhaps some narratives that we see, even in the academic literature, but certainly in the public sphere, one point that I think is really important to emphasize actually is that transfer programs, kind of public programs in general, actually work extremely well in reducing poverty in the United States. Certainly, the US has very high levels of poverty and economic precarity than other countries. And, perhaps understandably, right, this has led some policymakers, even some scholars, to question whether public investments kind of meet their stated goals, right? And we can talk about the nuances of those debates, but I think the key point is that there's mounting evidence, and the period of the pandemic actually provides a really interesting case study for this, but there's really quite clear evidence that a strong safety net reduces poverty in the United States. One example I always like to highlight is the really striking decline in child poverty that we observed in the US during the pandemic, when we had a temporary, pretty dramatic, near universal expansion of the child tax credit. So this was temporarily expanded in a really large way that went from being pretty targeted to certain segments of families with earnings to a really near universal benefit. And we saw a really dramatic decline in child poverty soon after that credit was expanded. And as soon as it was retracted, we saw child poverty go fairly precipitously and quickly back up again. So that's a really, I think, interesting example that kind of demonstrates that when we measure child poverty in the right way, that is in a way that actually accounts for the income that people receive from transfer programs, we see very clear evidence that it works. And some of the narratives that we've seen in the media especially have used definitions of child poverty, like the official poverty measure that's put out by the government, that actually does not incorporate the benefits that people receive from transfer programs.
So, but I want to push you just a little bit on the sense of alleviating poverty, meaning that the overall household income goes up. So we had subsidy checks during COVID. The refundable earned income tax credit also gives more money to the household. But how does that actually translate into sort of better health or better school performance for these children? better opportunities later in life. I think that's the sort of question mark I have when I hear poverty levels have been reduced by these transfers, but what effect are they actually having? Like, what are these households doing with this extra money?
Yeah. So that in particular, even more than measuring poverty, is the focus of my work, right? So when we look at declines in poverty, of course, that's the first order question is, do people have more money? Are they less likely to live in poverty? But then we want to understand all of the extensions of that. Like, do they have an easier time paying their bills, right? Do they have an easier time putting food on the table? AKA, do they have lower levels of food insecurity, right, for themselves and their kids than we saw before they got that boost in income? And what I've been looking at with a lot of data on kind of interesting data on consumer expenditures and consumption data is, do parents spend more money on a set of items that we would kind of classify as, quote, developmental items for their kids when they receive more, not just money, right, but more resources more broadly from government investments? And the answer is yes, actually. We see parents spending more money on things like books or lessons and activities, for their kids. And we see that especially among the lowest income families in the United States, for whom that gap, right, that we talk about with respect to resources is so important. So we can see it when we look at money. We can also see it when we look at the types of behaviors that parents and mothers in particular engage in. Are mothers and fathers able to spend more time with their kids? Even conditional unemployment, right, when they have better support from the state. So those are some of the outcomes that we try to look at besides.
And when you're using these, your resources at Brown to conduct this research, are you doing things like sending surveys out? Do you look at, credit card receipts, or do they make, now that SNAP comes on a debit card, do they make that kind of expenditure data available to you? How do you dig in with all the work that you do at Brown with your undergraduate students and your graduate students? Where do you dig in to get this kind of information about spending habits?
Yes, there's all kinds of data that we can use to look at these questions. The best data in a lot of ways is data that is collected from representative household surveys, right? That we know they're collected with a certain degree of quality. The Consumer Expenditure Survey is one example. This is put out through the Bureau of Labor Statistics. This is a federal data resource that allows us to understand over a period of many decades the extreme nuances, right, of what people are spending their money on, who they're spending it on, and their family, et cetera. So that is by far, I think, the kind of gold standard in terms of the quality of the data that we have, especially when we're looking at these patterns over time. But increasingly, yes, people are getting data from credit card companies or other types of big data resources. The problem with some of those data sources is that they're often, quite expensive, right? They're kind of a fee-based data resource, and they're often kind of patchwork, right? So you might get credit card transaction data for a point in time for one segment of the population, but you're not getting that full snapshot of everyone's behavior, right, in the whole country over a long period of time. So the vast majority of my research relies on survey data, as opposed to collecting my own small scale data or purchasing expensive data from companies.
Yeah, I like to ask scholars these questions because a lot of us in the community don't always know, how are you getting the data? What are the undergraduates exposed to? So that's just fascinating that undergraduates and graduate students have that opportunity at Brown. I wanted to ask a question about the Department of Education. It's been in the news. It is your area of specialty in terms of these support programs and services, particularly to children who are low income for remedial educational services. So like Chapter 1, basically block granted by Reagan many, many years ago. How do these programs intersect with the other social safety nets for children and families? And what potential changes do you see with, let's say, an elimination of the overarching structure of the Department of Education?
Yeah, no, very big question and very timely. So Chapter 1 or Title I funding is a really important part of the federal funding that school districts get in the United States. And on the one hand, people often see this and they think, well, we're seeing in the news a lot now, well, federal funding is only a very tiny share of funding, the total amount of funding, right, that schools receive. It's only something like 10%. Title I funding in particular is even smaller share. It's maybe only like 2% of overall funding. However, I think the point that's really important to emphasize is that in many states, because Title I funding is directed specifically at services for lower income students, in many states, Title I funding makes the overall funding for schools in a particular state progressive versus regressive, right? It makes that funding disproportionately benefit lower income students as opposed to higher income students. And so there's some really good work that shows that in a lot of states, nearly half of states in the United States, funding that looks kind of regressive when you only account for state and local funds becomes progressive when you account for federal funds.
Are you talking about the amount of money spent per child? Is that the way you're measuring progressive versus regressive?
Exactly. The amount of money spent per child, but also the amount of money that low-income kids in particular, right, are receiving from a bundle of different kind of levels of investments.
And you mentioned something that's so crucial, because I think a lot of us also don't know this. Is it a stereotype that that urban areas or more dense population have lots more poor children and families? Or is it proportional that we have a lot of poverty in rural areas as well? So if you had to think about describing the distribution of the percentage of children in families in poverty and those that might need these, particularly Title I educational services, what does that look like geographically?
Yeah, good question. So there's a lot of dimensions to that, but I think the one way to summarize it quickly is that the poverty rate today in rural places, rural communities in the United States, is actually much higher than in urban and suburban places, even though most people don't live in rural places, if that makes sense, right? So something like 80 or 85% of the US poor population, in terms of the number of people, lives in cities or suburbs, compared to only about 15% living in rural places. But poverty rates, the likelihood of being poor is much higher, right, among people living in rural places. And this is true in all regions of the country, but especially in the South, we see that in the most pronounced way. So that's one feature of poverty today that's really important, right? It's not kind of equally distributed geographically. Poverty is also...
Go ahead.
No, I was just going to say some other kind of key features of poverty, is that it is definitely disproportionately concentrated among non-white populations and among Black households in particular in the US. And again, this is especially the case in rural areas compared to urban and suburban areas. So I think about 30% of Black individuals in rural areas are poor, compared to about 13% of white individuals in rural areas, is one kind of striking statistic. And then I think because we're talking about kids, it's also worth emphasizing that poverty is disproportionately high among kids in the US versus adults, and certainly versus the elderly population. So,
we have time for one more question. We'd love to have another conversation with you about the effect of all of the Great Society programs in the 1960s and the shift really after that in a lot of resources to alleviate poverty among the elderly. Of course, pre-Johnson Great Society, the elderly were quite poor, and then post with Medicare, in particular Medicaid nursing home coverage and things like that, older people don't suffer the same rates of poverty exactly you suggest that children do. And so this will be a very interesting political dynamic to watch unfold in this new administration. And if we had the time, we'd love to engage you there. But I think I'm going to go with a final question that I hope you can expand on, which is, as a sociologist and a scholar and a well-acclaimed Brown professor and teacher, what are the strongest arguments for preserving federal programs aimed at alleviating childhood poverty and addressing its root causes?
Yeah. So I think one really pragmatic argument that is worth emphasizing and that I think should have really broad appeal, certainly politically, is that investing in children has really, really large social and economic benefits, right? So, investing in early childhood interventions, for example, can yield a very, very large return on investment. So there's a really well-known Nobel Prize winning economist, James Heckman, who's done some really useful work on this topic and has tried to kind of quantify, right, the impact of childhood interventions and programs by age, even in terms of the return on investment. And he's measuring things like increases in school and educational achievement, labor market outcomes, reduced engagement with the criminal justice system, improvements in health, right? And these are really based on long-term follow-up of children as they progress into adulthood. So I think the key point is that, many scholars have demonstrated that investments in childhood programs can pay really large dividends in general, and including, and maybe especially during times of budget crisis, and that these investments are particularly beneficial for the most at-risk youth or kids who live in the most disadvantaged environments. So even if one doesn't subscribe, to reducing child poverty from the standpoint of inequality reduction, being a positive thing for individuals or for social cohesion, and there's good evidence on that too, there's just really ample evidence that it's good for the economy and for the vitality of the U.S., economic system. So that would be my short answer.
So, because in the end of the day, a child who grows up in poverty without a lot of assistance, without a lot of these tools, particularly educational and health assistance, is more likely to live a life in poverty than a child who receives these services. Is that pretty much?
Yeah. And relatedly, a child who has the opportunity to build skills, both academic and non-academic skills early in life, those skills, we have good evidence, build on each other, right? So if you have the benefit of skill development as a young child, that will continue to benefit you as you progress through the school years in ways that really multiply with age.
Well, on that note, we're going to have to leave it for today, but we really look forward to additional conversations with you. It's fascinating. We've been talking with Professor Margot Jackson of the Sociology Department and Director of the Center for Population Studies and Training Center, which is a vital component of producing a lot of the research we do at Brown on children and families. So thank you so much for taking time to talk to us today.
Great. Thanks very much.